Which of these two faces looks more attractive? You probably picked the one on the right. The quality that makes this face more attractive is midface projection. When a face lacks midface projection, it looks flat. And in this video, we'll be covering what midface projection is, how to measure it properly, the anatomy of the face that produces this quality, and how to improve this quality in your own face. Now, as a quick disclaimer, this is for educational purposes only and is not medical advice, and you should always contact a medical professional for any actions you take regarding plastic surgery or cosmetic procedures. Midface projection is simply how far forward this area is displaced relative to the cranial base. And this quality can be measured using 4 angles and ratios. The orbital vector, which measures how far forward the infraorbital ridge is located relative to the corneal apex. Your facial depth to height ratio, which measures how deep the face is relative to its height, and it is the #1 indicator of forward projection. The anterior facial depth angle, this will tell you about the projection of the maxilla and the infraorbital ridge, as well as the harmony between the two. And we'll come back to these bones later. And lastly, the interior midface projection angle. This measures the position of the midface directly relative to the eyes, and it is a very strong indicator of midface projection. Now, no single measurement can diagnose midface projection or flatness, but using them together can paint a very clear picture of the anatomy. And if you want to compare your measurements to the ideal ranges, I've organized all of them into a database which you can access for free inside my school group, which is linked in the description. Now, each quality of midface projection comes from a very specific piece of anatomy, and these can be broken down into bones and soft tissue. Now, each bone we list has 3 vectors of position because it is a 3D object, but for this video we're only going to be talking about one of these vectors, which is the anterior position, or more simply, the forward position. So the first bone is the maxilla. This is going to be this yellow bone located in the middle of the face. You can actually feel this bone on your own face if you take your fingers and press directly behind and beside the nose. And this bone is going to determine where the midface sits, because it pretty much makes up the entire midface. The second bone is going to be the zygomatic bones, also known as the cheekbones. On the skull model, that's going to be these dark purple bones at the side of the eye socket. You can feel these bones on your own face by taking your fingers and just placing them to the side of the lateral canthus. This bone is going to determine your infraorbital projection because the zygomatic bone makes up part of the infraorbital ridge. Now, the inner part of the infraorbital ridge is going to be made up by the maxilla. And the last bone is the nasal bone, which is this light purple bone on the skull model. You can feel this bone on your own face by taking your 2 fingers and placing them on the part of your nose directly in between your eyes. Now, this bone is going to determine the projection of the radix, which is the part of your nose located in between your 2 eyes. And this is a very important part of anatomy for determining how forwardly projected your midface looks. Now, as for soft tissue, we basically only have nasal cartilage. Now, nasal cartilage is going to determine the prominence of your nose, specifically at the nasal tip. However, it is going to have much less of a significant impact on midface projection since we define the midface as being the area located behind the nose. So, how do we get this quality in your own face? For every video I make, I always try to find Softmaxes that can at least hide the flaw, so that way people at home can try something right away that will help them. But this video was a little bit difficult to make because there really isn't any Softmaxes that you can fix midface projection. That's because the projection is mostly coming from the bone. But there is one Softmax I was able to find, and it's called prosthetic makeup. So basically, prosthetic makeup is just sculptable silicone pads that are glued onto the face, and then they're blended in with makeup. And their purpose cosmetically is to add projection where projection is missing, in this case, the midface. Now, prosthetic makeup is not normal makeup. There's very few brands that actually sell it, and the ones that do are mostly meant for special effects. The closest version to what I'm describing is silicone cheekbone prosthetics, like the one sold by Jess FX. These can physically add cheek projection, but they're still closer to cosplay makeup than to normal daily makeup. And for the nose bridge, it's even harder to find subtle products. Now, the most practical option if you wanted to try it out is to contact a local makeup artist and ask them to make custom prosthetics that meet your aesthetic demands. But even if you did that, the problem with prosthetic makeup is that it's not very practical for daily use. And if you were to get caught wearing it, it's not a very good look. So in that case, what can we do? One option is minimally invasive procedures. These require oversight from a medical professional, but they don't qualify as surgery. And there are two options, filler and fat grafting. Filler can be used to add projection pretty much wherever you need it. So for example, it can be used to add cheek projection. And fat grafting is often used to fill in a depression in the infraorbital area. A lot of the times that depression would be causing dark circles, but other than the infraorbital area, fat grafting isn't really used for projection. Even with these techniques, you're still not going to get a whole lot of projection, and so that pretty much just leaves us with the Hardmaxes. Now, each Hardmax is a surgery, which means that it needs oversight and planning from a medical professional. And there really is only three options for fixing a flat midface, and those are jaw surgery, nasal osteotomy, and custom implants. So with jaw surgery, it's going to be used to move the maxilla forward, and it also moves the lower jaw forward too in order to preserve the bite. Now, in order to reposition the bone, they first have to cut it, and in jaw surgery, they make those cuts along what are called Lefort fracture lines, which are basically natural weaknesses in the bone. And there are three main cuts used. The first one is a Lefort 1. This moves the base of the maxilla, and it can change the depth to height ratio, the anterior facial depth, and the interior midface projection angle. In a Lefort 2, the cuts are made a lot higher, and this allows them to include everything that a Lefort 1 does, but it also moves the inner side of the infraorbital ridge and the nasal base and the radix. Now, a Lefort 2 is rarely done for cosmetic purposes, but it is still possible to get done. And the last one is a Lefort 3, where the cuts are made way higher up on the face, which allows them to move the cheekbones and the entire infraorbital ridge. And this gets even more midface movement. However, it's almost never done cosmetically. The higher the Lefort level, the more risky it is, and the less likely a surgeon is going to be willing to do it. However, with midface projection, a lot of the time you only need a Lefort 1 because the projection of the areas further up can be increased with custom implants. Now, custom implants can be used to increase projection basically wherever it's needed, which is where the custom part comes from. And some places include the infraorbital ridge, the radix, the subnasal, and the nasal bridge. Custom implants can also be paired with Bimax to give a more aesthetically powerful result. And in fact, a lot of the time, custom implants are used in order to prevent the crocodile face deformity that comes from aggressive jaw movements. And that's basically because the jaw is being moved or expanded so much more than the areas above it that it starts to disrupt the harmony of the face. Now, the last technique for midface projection is a nasal osteotomy. Now, this is a newer and less common surgery that can move the midface without moving the jaws. And this can be used if the flatness is coming from the nasal base itself and not necessarily the cheekbones or the jaw. So to wrap everything up, the midface is the area located behind the nose. When it lacks projection, it makes the face look flat. You can measure midface projection using specific angles and ratios, and this projection is coming from the bones of the midface. And because the projection comes from the bone, if you wanted to increase it, you'd have to use plastic surgery techniques such as osteotomies and custom implants, but sometimes it can be frauded with special techniques like prosthetic makeup. And lastly, I want to mention that I do one-to-one face analyses where I use the exact same logic we used in this video to help you understand your own face and make the right decisions to improve it aesthetically. At the same time, I also give away free resources, and all of that can be found inside my school group, which is linked below.